They're talking about partnership that exists on every level, from trade to security to education and to health. Now, there's a lot of work for all of us to do to make the world a safer, healthier place. And with our nations working together, we can reach the goal of controlling and preventing diseases like TB. Today, we're here to renew our commitment and partnership with the government of India, the private sector, and civil society to make India TB-free. The United States, through the U.S. Agency for International Development and the Centers for Disease Control and Prevention, have been actively engaged in working alongside the government of India to end TB in India. The United States has invested close to $100 million to prevent and control TB in India over the past 18 years. And in that time, we've seen dramatic improvements in diagnosis and care. Over 15 million patients have been treated for TB, and millions of lives have been saved. And India has made tremendous progress in reducing TB, but much more needs to be done. That's why visionary leaders like Mr. Bachchan and Mr. Tata have committed their support. They recognize that we can stop TB and no one should die from it. Ending TB in India will ensure a healthier and more productive future for all of us. And Dr. Prasad, as well, on behalf of the government of India, we thank you and all that you have done and the ministry has done. As I mentioned, USAID is currently partnering with the government to support the call to action for a TB-free India. The health minister recently launched this national campaign to mobilize support from corporate leaders and civil society in April. The U.S. National Institutes of Health is supporting a multi-million-dollar research network to strengthen TB research and infrastructure and improve India's ability to prevent, detect, and treat TB. CDC is also partnering with Indian institutions to strengthen TB diagnosis and treatment. Now, just a few minutes ago, we had the opportunity to meet with corporate leaders to discuss why it makes sense for them to support this effort. Corporate leaders and civil society and other healthcare organizations. And we had a very productive meeting. And I am hopeful that many of them will join in this cause. And we're very grateful and excited that Mr. Tata and Mr. Bachchan are here today to discuss their roles as champions for the call to action. And I'd first like to welcome Mr. Tata to make a few remarks about how corporate leaders can contribute to ending TB. And Mr. Tata, I turn it over to you, followed by Mr. Bachchan and Dr. Prasad. Thank you.
Thank you, Mr. Ambassador. First of all, let me just make a statement that it's a great privilege and a great honor to have been invited to be an ambassador in this program. To me, it's more than just a campaign. It's an issue of being involved in a national cause. TB has been a silent killer in the country and has assumed proportions that most of us should be extremely concerned about. Concerned because TB is infective, and can spread, and it could affect any one of us or our members of our family. It's something that in the past has had stigmas, so it gets put under the carpet or remains silent, and it affects jobs, it affects women's marital future, it affects children, it affects rich and poor. So it's not just a poor man's disease, it's not just a geographically controlled disease, affliction. It's something that affects the entire country. as a citizen of the country, I feel very committed to play my role, however big or small it may be, to help in this partnership with the Government of India, with USAID. And of course, great pleasure to be with Mr. Bachchan on such an important issue. I feel that this is not just a government responsibility, it's just not an industrial responsibility. It's a responsibility that each of us carries. If we help create an awareness in terms of early detection, early diagnosis, the right kind of treatment, if we support the government in what has been a very effective campaign, we can arrest this as we have polio and smallpox in the past. So for me, it's a great privilege to be here, and I've always thought in my life that I'd like to be involved in something that makes a difference. And if we can make a difference in this area, I think all of us should be very pleased. Proud, perhaps, is too selfish a word, but pleased that we have been able to rid our country of something that could and would be a very silent killer. We need a prosperous country of healthy people if we plan to go through the journey that we have in terms of economic growth. And it's a great pleasure and privilege to be involved in something as important as this. So thank you very much.
His Excellency, the Ambassador of the United States of America, Mr. Ratan Tata, Dr. Prasad, members of the media, thank you so much, Mr. Ambassador, for inviting me here today and giving me an opportunity to express my views on this very noble cause that you have undertaken under the American Embassy. I met Ambassador Verma at a formal function in Rashtrapati Bhavan, and as we were casually walking out, he talked to me about wanting to meet up and speak to him about a cause that he was wanting to promote and propagate. I felt that was perhaps just a casual little chat that people, when they go to formal functions, have, but the ambassador actually followed it up with a letter, and I immediately responded to it. The details of what the ambassador was wanting was closely connected to me. I had already worked on tuberculosis in the city of Mumbai for the Municipal Corporation of Greater Mumbai. We have already started a campaign, and many films have been made, and this propaganda was already on. So when he talked about tuberculosis, I felt just morally, socially, individually attached to it. I think during the time when we launched that campaign, I spoke to the media and told them that I myself was a sufferer of tuberculosis in the year 2000. It was detected quite by accident, but the fact is that I did undergo a certain course of action during that period of time. It took about a year, and it's a heavy dosage of tablets and medication. But the fact is that I stand here before you cured of tuberculosis, and perhaps as an example to many others who are perhaps going to be hopefully not inflicted by this disease, but to tell them that, you know, if I may, as I just said, be a little immodest, if it could happen to me, it could happen to anybody. Tuberculosis is normally linked with having spread in a community of people that live in lesser means, in poor environments, and I felt that we who are fortunate enough to have lived in better environments can get this disease than anybody could. But there is a cure for it, And we've just had a wonderful meeting with several medical heads of the country, corporate heads, where we've discussed many of these issues. There's been great support from the American Embassy. We've just heard the ambassador making a contribution of $100 million. We've had wonderful inputs from the government of India by Dr. Prasad, who has given us an insight into what the government of India is undertaking. I myself am committed to this cause. As I said, I've already been involved with the MCGB campaign, and the government of India has just made an offer to me at the meeting before this, and I have very happily agreed to be ambassador for the country to eradicate tuberculosis. Some of the things that are associated with tuberculosis, apart from the fact that I suffered from it, was to me disturbing, is the part that discriminates individuals from society. In particular, women, young women of marriageable age are discriminated against in various communities if they are known to be carrying tuberculosis. Marriage proposals go wrong, and if you're already married and you know, unfortunately get afflicted by tuberculosis, then you are kind of almost thrown out of the house. Apart from the many other problems that Indian women face in marriages, this to me seemed an even worse example of what Indian women have to go through. And I feel that this can be corrected in a sense if we work towards this campaign where we can detect it, cure it, and make a kind of awareness with people, and particularly to these homes where these married women are facing all these problems, these social problems, the stigma of being sort of made an alien in society, to be told that this is not something that needs to be put away. It can be treated, and here is one example that is standing in front of you. And through our campaigns, if we can destroy this myth that women or people who are inflicted with this unfortunate disease are almost treated like pariahs in society, that's wrong. That should not happen. And therefore, there is a lot of meaning behind this cause, and I feel very obliged to the American Embassy for taking this up. I feel obliged to the Government of India and Dr. Prasad for initiating this, and of course to Mr. Tata for giving us his great support, not just in his various corporate activities, but also when you have a name like Ratan Tata, people want to take you a lot more seriously. I have committed myself to this cause primarily because, as I said, there was individual interest. I feel that alienating people from society because they are suffering from a particular stigma is wrong, and we should correct that. I feel that we can all sit here and discuss to the media lovely words and lovely ideas and lovely thoughts, but I want to still instill in the people that are going to be looking after this campaign that it is the worker who is going to go out into the fields, into the rural areas, into the smaller villages, to inculcate in them this theory that here is a medication that can cure you, and that is not a stigma. It is something that you should not use to get rid of certain members of your own society. So it is that worker that is actually the most important person. I say this because during the time of the polio campaign, of which we were very successful with, it was the worker that actually went into very dangerous terrains all throughout the country to administer those 2 drops of polio vaccine. And that is why today India is polio-free after a huge effort of almost 8 years. I do hope that whenever a construct is made, Ambassador and Mr. Tata and Mr. Dr. Prasad, of how this operation is going to work, that we choose very dedicated workers. And I do hope that the Government of India and various states where these people go and work are given the encouragement and the facility to be able to go out and work in these fields, because they are the people that will be actually responsible for bringing notice to us where help is required. I, as I said, I am now committed to this cause, and wherever the government of India or this group through USAID and the union wishes and desires me to operate, I shall be more than happy to do this. Thank you.
Good afternoon. His Excellency Sri Richard Verma Sahab, Sri Ratan Tata ji, Sri Amitabh Bachchan Sahab, media people, ladies and gentlemen. I think this is a great occasion, and I must thanks to Mr. Richard Verma, who has brought us here and getting the corporate and Bachchan Sahab involved in the tuberculosis program. As all of you know, this is one of the successful program of the government of India, and although we have achieved the Millennium Development Goal, which was fixed by the WHO, still we are losing every minute about 4 patients by tuberculosis. So nearly 3 lakhs people we are losing by the tuberculosis every year. So this is a great number, which is 100% treatable disease. And this doesn't see, as Ratan Tata ji has told, that doesn't have a geographical location, doesn't have a rich or poor people, because Bachchan ji is such a sophisticated man, and richest man also got tuberculosis. So tuberculosis doesn't spare anyone. Whoever has a little bit less immunity or come in contact, directly contact, get the tuberculosis. And I think this, if we have to have a control of the tuberculosis, because 1/4 of the world population is tuberculosis in the country, and if we have to control it, it is not only the government of India, but it is a national problem where the civic society, corporate has to work together. And I think I'm happy to tell you that Sri Bachchan Sahab has agreed to become the national ambassador for the tuberculosis. And I think he was asking that how much impact of his campaigning. There will definitely great campaign and great awareness will come among the people, and people who are not coming forward towards the treatment of tuberculosis will come up. Recently, we have now started the free treatment to all, even the private people who are writing the drugs in the 5 states. And Maharashtra is one of the states where we have chosen. And in due course of time, we are going to make we are giving the treatments to all the rural and public health system. But we are trying to catch hold of all the private practitioners who are writing the drugs of tuberculosis to get the free treatment. And another program the government of India is taking the nutrition. So this time we have also focused on not only giving the drugs, but we are trying to give, and we are asking the state to take the money from us to give the nutrition to the patients who are suffering from tuberculosis, at least high protein and high caloric diet. That is one of our agenda. So I hope that the USAID and Union has brought us here, that corporate should get involved, because I can tell you that I am really obliged to Bill Gates Foundation, who has really opened my eyes, because when we asked him that we want to do a pilot project in Patna and Gujarat, and when we did the free treatment to all the people, rich and poor, and to the private practitioner, the number of and same times, last 8 months back, Bachchan Sahab has also made a campaign of TB Harega or Desh, Jitega. That's also put a great impact on the people. And the number of the patient has definitely increased from 170 to 300 per lakh populations. So this has great impact, and we came to know that lots of patients are going to the private practitioner and who are taking irregular treatment. And that is the reason, and now we have launched that why not to give the drugs to all the people who are getting even the prescription from private people to other people. And I think by these methods and by involvement of the corporates, involvement of all the sectors, and especially you media people, if you can make more awareness that this is the 100% treatable disease, get the drugs, you will be 100% cured. There is no stigma on that, because you have a very vital role to play. So if this message go to all over the country, I think we will be able to control our tuberculosis, and our country will not be put up as a 1/4 of the world population. We want to see that in another few years, 2 to 3 years, this country should become 1/10 of the world population of the tuberculosis. That is our target of the government of India, and let us hope that we all work together and achieve this target. And thank you, His Excellency Sri Verma Sahab, for calling us and making this campaign a national campaign and bringing the corporate to make interfere in these sectors of tuberculosis. And I hope that by entering in the tuberculosis sectors with all of you, we can achieve our targets. Thank you very much.
Thank you again. When we organized this, we didn't realize it'd be so many people, but it's been a terrific time here. And again, I appreciate the participation of our 4 guests on this important occasion. Thank you again. Shukriya.